Hello and welcome. So I have conjunctivitis. It's a kind of eye infection. So I'm going to talk about these things later, but I'm going to wear these sunglasses so you can avoid my looks. Anyway, so today's topic is vermiform appendix. Is very important structure in our abdomen. So it's a kind of a diverticulum arising from the posteromedial wall of the cecum. Well, I have talked about cecum in large intestine videos. You can check that. Suppose this is the cecum and this is the ileum, terminal part of the ileum or small intestine known as ileum. So it is entering into the cecum. So this is ileocecal junction, and almost 2 centimeter below you're going to find the appendix in posteromedial wall. So you can say that the posteromedial wall is the base of the appendix. Anyway, why it is known as vermiform? Because it is vermine or worm-like structure. Okay, now the length of this appendix ranges from 2 centimeter to 20 centimeter in entire phase of life, but in younger children it is larger, it is longer than the adults. Okay, and now the position. Remember, as I said, that base of the appendix is fixed because it starts from the posteromedial wall of the cecum. Okay, now the tip of the appendix is free, so the position of the appendix depends individually. You can find different position in different human. First of all, 11 o'clock position. What is this? You're going to find the tip of the appendix in lateral position or lateral to the cecum or lateral to the colon. So you can tell it paracolic position of the appendix. Okay, but in shortcut you can say 11 o'clock position. Secondly, the tip of the appendix presents behind the cecum. So you can call it retrocecal position, straight upward, just like 12 o'clock position. Okay, so it is the most common position of the appendix. Third of all, 2 o'clock position. What is this? The tip of the appendix drifts towards the spleen. Okay, so you call it splenic position. In this condition, the appendix may present in front of the ileum, so we can call it pre-ileal position, or it can present behind the ileum, so we can call it post-ileal position. Fourth of all, you're going to find 3 o'clock position. What is this? The tip of the appendix drifts towards the sacral promontory. Okay, so we can call it promontoric position. Okay, fifth point, you're going to find pelvic position or 4 o'clock position, because the tip of the appendix remains in the pelvic part of the hip bone, and this is the second most common position of appendix. Okay, so first of all retrocecal, second of all pelvic, last of all our subcecal position or 6 o'clock position. It means the tip of the appendix directly directs downward towards the inguinal ligament, so straight downward, so you can call it subcecal or 6 o'clock position in shortcut. So remember all these positions for your exam purpose. And now the appendicular orifice or appendiceal junction. Okay, so the lumen of the appendix gets open in the cecum. Okay, now the opening is guarded by a valve, is known as valve of Geralch or Geralch, you can say whatever you want, but the diameter of the lumen of the appendix is almost 5 millimeter. Remember this point. Now this appendix is suspended in the abdominal cavity because it is attached with the peritoneum via Mesoappendix. It is a small triangular fold behind the appendix, as you can see in this photo. It is also known as appendicular mesentery. Now the blood supply. In blood supply, as always, arterial supply, venous drainage. In arterial supply, appendicular artery, branch of ileocecal artery, gone. In venous drainage, it is done by superior mesenteric vein, appendicular vein, ileocholic vein. Okay, gone. In nerve supply, same 2 components, sympathetic, parasympathetic. Sympathetic components comes from celiac plexus, gone. Parasympathetic components comes from vagus nerve, gone. Lymphatic drainage is done by ileocholic nodes. Now the function of the appendix, it's basically a vestigial organ, or it is a useless organ in human body, but it is very minor function in human body is it controls the localized immunity system by controlling B lymphocyte, T lymphocytes, and secondly it acts as a storehouse for beneficial bacteria of intestine. Now what are the beneficial bacteria, harmful bacteria, classification of bacteria, all I will talk about these things in microbiology chapter, not here. So this is all about our appendix. I hope you can understand and you can remember some of the facts. See you soon. Till then, bye.